A lot of you feel numbness in your shoulder, in your forearm, and in your hand. One common probable cause for this is what we call a cervical radiculopathy, or in layman's term, a compressed nerve in your neck. Let's do a self-check for cervical radiculopathy. I want you to answer yes or no with these 5 questions. Do you have neck pain? Do you have shoulder pain? Is the pain or the numbness and even weakness in your shoulder and in your hands only in one side of your body? Does the pain and numbness in your shoulder or in your hands increase when you extend and when you rotate your neck like this on the same side of the pain? Does putting your affected hand on top of your head like this decrease your pain? If your answer is yes to these 5 questions, there is a high probability of cervical radiculopathy. The first 3 questions are common symptoms associated if you have a compressed nerve in your neck. The 4th question is a specific test that aims to elicit or reproduce the pain if you have cervical radiculopathy, while the last question is a test specific to decrease the numbness if you have this condition. Before I will teach you the one exercise that will help you manage the numbness and the tingling sensation in the comfort of your own home, please allow me to answer possible questions that you have in mind right now. Cervical radiculopathy is neck pain plus the component of weakness or numbness in your shoulder, forearm, and in your hand. You might be asking what causes cervical radiculopathy. If you are over 40 years old, the most common cause for this is osteoarthritis of the neck. But if you are younger than 40 years old, the most common cause for this is disc herniation, a condition in which the central or the middle portion of your intervertebral disc extends far beyond its borders. With cervical radiculopathy, there is narrowing in your spinal canal that compresses and causes an inflammation in your nerve. Now you might be asking me, why do I feel the numbness and the pain in my shoulder and in my hand when in the first place my affectation is in the neck, right? Well, this is because the nerves that allows you to move and feel sensation such as heat, pain comes from your cervical spine or comes from your neck region. Now, this might be confused with carpal tunnel syndrome, where you will have difficulty with gripping and you also have numbness in your 3.5 fingers. Well, with carpal tunnel syndrome, we have the compression of the median nerve at the wrist joint only. You don't have neck pain and you don't have shoulder numbness. I have mentioned this with my other video, but allow me to tell it to you. If you have cervical radiculopathy, you need to avoid 3 positions that will make your condition worse. You need to avoid extending your head like this. Extending your neck like this would actually give a smaller space in your spinal canal, which will lead to further compression of your nerve. We need to avoid slouching or the forward head posture. This is very common when we are using our mobile phones or when we are sitting in front of the computer. This position is bad for you because it will further speed up the degenerative process in the spine and in your intervertebral disc, and it can lead to numerous and chronic musculoskeletal conditions. You need to avoid extending your neck at the same time side bending to the area of the pain because this will further cause narrowing in the spinal canal, which can further compress your nerve. Our treatment plan is using this concept. We need to have an exercise and a position that will widen the space in your spinal canal that will help with the decompression of your compressed nerve. Now, this is only one exercise. You need to do this at least 5 times a week at least 2 times a day, because anyway, it is just one exercise and it will really help you. This treatment plan is not for you if you already have numbness and pain in both sides of your body, because that means that you need a personalized evaluation by your primary care physician. Our treatment plan should promote contralateral rotation and side flexion. Don't be intimidated by this. It just means that, for example, if you have the pain and numbness in the right side, right shoulder and right hand, you want to look to your left at the same time side bend so that your ear approximates your shoulder. You want to hold this position for 10 seconds. And then repeat it 10 times. This exercise will widen the space of your spinal canal and it will release compressed nerves in the right side of your body. If, for example, you have your numbness on your left shoulder and left hand, what you need to do is to rotate your head to the right and then side bend so that your ear approximates your shoulder. You need to hold this position for 10 seconds and then repeat 10 times. This exercise will release compressed nerve in the left side of your neck. Another thing that you can do is use cold compress. Cold compress are relatively inexpensive. They are cheap, and should you want to purchase one online, please click down below. It will lead you immediately to Amazon and Shopee. You would want to wrap this cold compress in a cloth, and then using a bandage, you place it in the area where you feel the numbness. You can do this also 2 times a day after your exercise. Since cervical radiculopathy entails an affectation of your nerve, you can load up in your diet foods that are rich in B vitamins. If you want to check out natural sources of foods rich in B vitamins, you can click on this video here. This is our treatment plan for cervical radiculopathy. You need to avoid the 3 positions that I told you, and you need to do the 1 exercise that I just taught you. Should you have any questions regarding cervical radiculopathy, please comment down below because I would really get back on you. This is again Doc Cherry. Stay safe, stay happy and healthy. God bless you. What would you feel if you do this for 60 seconds? If you feel numbness in your thumb, your index, middle, and ring finger, that is indicative of carpal tunnel syndrome. Carpal tunnel syndrome happens when the median nerve, the one that controls movement and sensation in your thumb, your index, middle, and ring finger, is impinged at the level of the wrist. These can be due to repetitive occupational hand activities like typing, computer use of vibrating tools, which can lead to nerve compression. Pregnancy, diabetes, and hypothyroidism can also put one at a greater risk of developing carpal tunnel syndrome. At home, what you can do is to use cold compress for 15 minutes in the wrist joint. This will help with the pain and inflammation, and this is especially helpful for the first 2 days. Do these 3 effective home exercises as well, in no particular order, but do it 4 to 5 times a week. These exercises have no contraindications, but when done consistently, this will significantly reduce numbness and pain and will increase patients' functional status. First is we do the ball hand exercises. We need a squeeze ball for this. This is very simple and very inexpensive. But this exercise can actually strengthen the muscles in your thumb, index, middle, and ring finger. And it will improve blood circulation in your hand, your wrist, and even in your forearm, which is needed for healing. You're just going to firmly squeeze the ball for 1 second and then let it go. You need to repeat this process for 1 minute. You can do this 2 to 3 times a day, and what's good with this is you can do it anytime. Next, we're going to do the median nerve glide exercises. I have taught this to you with my other previous video here, but I'm going to show it again to you because the purpose of this exercise is actually to decrease the pressure within the wrist joint. It will increase the mobility of the median nerve, and it will reduce the symptoms of numbness and pins and needle sensation. We have 6 positions for that. For the first position, you're just going to simply make a fist. For some patients who have carpal tunnel syndrome, even making a fist would be difficult for them. So use these exercises or do these exercises within your pain tolerance. Maintain this position for 5 seconds. For the second position, you're going to maintain everything or put everything in neutral position. Maintain this position for 5 seconds. Third position is you're going to extend your thumb like this. It's as if it's pointing to you. Maintain this position for 5 seconds. And then for the fourth position, you're going to bend your wrist like this. Maintain this position for 5 seconds. Fifth position, you're just going to simply turn it around like this. It's as if you're going to put a tray down. So you need to maintain this position for 5 seconds. And lastly, using your other hand, you provide gentle pressure on your thumb. Maintain this position for 5 seconds. You need to do this exercise 2 to 3 times a day, at least 4 to 5 times a week. If you're confused, I'm going to attach a free PDF copy in the description box below. That will be your guide as you do your exercise at home. Our last exercise is called tendon glide exercises. This is important because it specifically works in the flexor tendons of your thumb, your index, middle, and your ring finger. Fully straighten all your fingers with your wrist straight. Hold this for 7 seconds. Next is the hook position as shown. Again, hold this position for 7 seconds. Make a tight fist with your thumb over your fingers. Hold for 7 seconds. Next, fully straighten all your fingers as shown and maintain for 7 seconds. And do this position as if making a small letter C. Hold for 7 seconds and bend your fingers at the middle joint, touching the fingers of your palm. Hold for 7 seconds. Besides these 3 effective home exercises, you can also use wrist splints. The purpose of wrist splints is to prevent bending of your wrist as you sleep, which will increase your symptoms. Actually, the use of splints can actually lessen symptoms for as much as 67%. One important thing that you should also remind yourself of is to prevent excessive bending and extension of your wrist like this to allow nerve healing. Modify your workstation if needed. Check the position of your wrist while you are in front of the computer because treatment is useless if you keep on aggravating the nerve. In majority of cases, conservative management like home exercises, physical therapy and rehabilitation, use of vitamin B complex supplementation, and the use of non-steroidal anti-inflammatory drugs to relieve pain and inflammation works well with carpal tunnel syndrome. But if conservative management fails, other option is the use of corticosteroid injection, which is injected directly into the wrist joint. It will give quick but temporary relief. Our last option would be surgery.